Hello guys, you are welcome. It's 6:55 p.m. in Ghana. Yeah. And we are live straight from Ghana. You're welcome. My name is Queen Sika. And over here we talk about pregnancy tips, birth tips, generally pregnancy and birth education. So guys, you're welcome. Thank you so much for joining. I really appreciate you all. So the last time when we were on live, we discussed a lot about the first trimester, things that we need to avoid doing in the first trimester, like taking some kinds of chemicals, very dangerous to our health. And also we learned about the fact that we don't have to go to the nearby drugstore to buy drugs. When we find out that we are pregnant, anytime you're not feeling fine, we need to go straight to the hospital for checkup so we can be taken care of by the doctor. We learned a lot. So if you missed the live, you can scroll down and you are going to watch everything yourself. Fantastic. So today we are talking about things that we need to avoid in the third trimester. So as you approach your due date of delivery, it's essential to continue taking care of yourself and your baby. So here are some of the things that you need to take good care of. Avoiding excessive exercise. Yes, exercise helps. It is really recommended that you exercise during your third trimester, but it is very important that you avoid strenuous exercise because it could cause injury to your body and it will cause excessive fatigue. Okay, excessive injury and excessive fatigue can make you give birth before time. Okay, so you need to listen to your body and then rest well. Make sure you listen to your body, even though exercise is good. So you want to exercise in moderation. All right, fantastic. Please, if you are new here, you're welcome. Thank you so much for joining. My name is Meredith. I coach people to live a healthy, active lifestyle. Thank you so much for the like. I really appreciate you. So you are all welcome. Feel free to leave a question where you are watching us from. You want to say hi, you want to say hello to me. Wherever you are watching from, you want to leave a comment in the comment section, okay? Fantastic. So the next thing that we are going to be discussing about is sleeping on your back. On the third trimester, we need to avoid sleeping at our back. Why? As your uterus grows larger, sleeping on your back can put pressure on your major blood vessels. Okay? When you sleep on your back, it will put pressure on your major blood vessels, potentially reducing the flow of blood. Okay? You see, blood flow is very important to the uterus. So when you sleep on your back, it reduces the flow of blood to the uterus. That is your baby in your belly. Okay? Which is very wrong. Your baby needs blood supply to be very healthy. So instead, you want to sleep on your side, preferably on your left side, so it can improve circulation. Sleep on the left side. Don't sleep. It helps circulation. The ulterior motive here is to improve circulation so that your baby can receive blood supply. You know, the blood supplies nutrients to your baby. Okay, your baby only feeds through the nutrients from your blood. So we need to sleep on our right and left side to improve circulation so that it can supply nutrients to our baby. As we are discussing, please, if you are new here, you're welcome. You can leave a comment in the comment section. You want to say hi. So I really appreciate you joining. You are so welcome. Okay. Now the next thing that we normally do, and I am part of it. I remember when I was pregnant, I was overeating. Like I was binging on anything. I was just eating and eating and eating. You want to stay away from overeating, my darling. You want to stay away from overeating. While it's normal experience to have increased hunger during pregnancy, overeating can lead to discomfort, okay, and unnecessary weight gain. You don't want to gain weight, because when you gain weight, it can lead to obesity, okay? So you don't want to be eating anything, binging on anything at all. You need to have a schedule, plan your eating. If you're feeling hungry, make sure you can binge on proteinous food, proteinous diet, fruits that contain protein, vegetables that contain protein. After you have had your 3 squared meal, make sure you binge on proteinous food. You can have nuts and so on and so forth. Okay, so focus on nutrient dense foods and listen to your body's hunger cues. Okay, fantastic. Now, the next thing that we want to focus on is or avoid doing is ignoring the signs of preterm labor. Ignoring the signs of preterm labor. Now, educate yourself about the signs or and symptoms of preterm labor, okay? Such as regular contractions. If you have reached maybe 6 to 7 months, and then you are having regular contractions, okay, if you are having lower back pain, if you are having pelvic pressure, all right, or vaginal bleeding, these are signs of preterm labor. You don't have to ignore. When you see these signs, make sure you visit your doctor. Contact your healthcare provider immediately if you experience these signs. All right. Lower back pain, consistent lower back pain, pelvic pressure. All right. Pain in your lower abdomen severely, vaginal bleeding, and regular contraction. Make sure you visit your doctor or you call your doctor, complain so that you can be taken care of, because these are signs of preterm labor which needed not to be ignored. All right. Now, the next thing that we want to avoid is ignoring changes in fetal movement. Okay, fetal movement. Now, we need to concentrate, we need to think, we need to always know that the movement of the baby in our belly, we need to take note. So when there are changes, you need to work on it. I remember my baby was kicking, that is my last baby was kicking very well at around 7 months, 8 months. But when I reached 9 months, maybe 1 week to delivery, the kicking slowed down. And the time that I was supposed to go to the hospital, when I went to the hospital, in fact, it was the intervention of God that I delivered safely, because even the doctors were trying to listen to the heartbeat of the baby, but they weren't. And these things, they can cause stillbirth, okay? So we need to take note of the movement of the baby. And if we don't feel that our babies are moving immediately, we need to draw the attention of our healthcare provider so that we can be taken care of. So pay attention to your baby's movement and report any significant changes to your healthcare provider. A decrease in fetal movement could indicate a potential problem that needs to be addressed urgently. It's very, 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 very important. Very, very, very important. We don't need to ignore at all. So we need to pay attention, especially if we are first-time moms. If you are a first-time mom, you need to take note how your baby is moving. If you don't feel that your baby is moving, go to the hospital. Call your doctor. Call your midwife so they can attend to you. Now, the seventh thing that we need to not ignore is ignoring signs of preeclampsia. Watch out for symptoms of such as severe headache, like too much headache, vision changes, like you're having blurred vision, abnormal vision. Also, you're having swollen legs, you're having weight gain, and then some different types of symptoms that are not normal. We need to pay attention because they might cause preeclampsia. So we must take note of sudden weight gain, bloated legs, your legs are bloating, all these swollen legs, all these things we need to pay particular attention. For instance, your leg will be swollen, and then when you press on your leg like this, it is how will I put it? It is entering. How will I put? There is a hole. When you press your leg, you find out there is a hole. When you press, you find out there is a hole. These are some of the signs of preeclampsia. Okay, frequent headaches and so on and so forth. So we have discussed about 7 things that we need to avoid when we are in the third trimester. Number 1, we have talked about excessive physical exertion. We need to be doing lightweight exercises. We need to be active, but we need to be cautious not to do excessive exercise like biking, hiking, and all sorts of exercises that will strain us. And then sleeping at your back. We need to always sleep at the left hand side, which will help to improve blood circulation. And also we need to also avoid overeating. Okay, we need to have a schedule. If we are eating 3 square meals, we are eating so that we are not over full. Okay, so that we cannot move. No, we want to be eating sizable plates, and also take in snacks with protein, nutritious food. We don't have to be binging on anything, sugary foods and so on and so forth. All right, we need to be very, very, very precautious. Okay, and then we also need to pay attention to some symptoms. Okay, preterm symptoms like regular contractions, lower back pain, pelvic pressure, vaginal bleeding, and so on and so forth. If you're having bleeding in the 3rd trimester, it's the symptoms of preterm. So we need to visit the hospital so that we can be checked and then taken care of appropriately. Okay, and then we also talked about ignoring fetal movement. Okay, we don't have to ignore when our baby is moving. No, let's say for instance a day your baby kicks around 1 hour. Every 1 hour your baby is kicking, but that particular day your baby didn't kick for like 10 hours. Your baby didn't kick. We need to be precautious. We need to be taking note of these things so as to be avoiding some severe issues. Okay, And then some of the symptoms that we also need to be aware of: severe weight gain, swollen leg, headaches, and some vision changes, and then a whole lot of small symptoms we need to pay attention to. If we recognize that, or we know that, or we see that some of these symptoms are happening to us, immediately we need to visit the doctor so that they can take care of us. Thank you so much for joining me today. In our next live, we are going to be discussing home birth. How to have a safe home birth. Thank you so much for joining us today, and I hope to see you in our next live. Comment in the comment section. Please, if you have any questions, feel free to ask me it before we leave. Any questions, feel free to address it in the comment sections before we leave. I'm waiting. Okay, so since we don't have any questions,